What kind of long-term problems can you have after a sentinel lymph node biopsy? I'm Dr. Amani Jambekar. I'm a fellowship-trained breast surgical oncologist, and recently I've made a couple of videos explaining what a sentinel lymph node biopsy is and have gotten some comments like this one from someone who thought that they were just going to have 4 lymph nodes removed and ended up having 8 removed and had complications because of it. This person says that they're dealing with mild lymphedema, but what's worse is a complete loss of feeling along the back of their arm. This is a study that was published in the Journal of Surgical Oncology in 2021, and it's a review of many different studies looking at the effect of sentinel lymph node biopsies on upper limb function in women with early breast cancer. It included about 5,000 patients who had undergone sentinel lymph node biopsy. And 6 months after the surgery, 0 to 11% of the patients presented with lymphedema, 11 to 16% of patients had persistent pain under the arm, and 2 to 22% of patients had sensory disorders, meaning they couldn't feel on the back of their arm like this patient. And 0 to 9% of patients had motor disorders, meaning that they had problems actually moving their arm. They also noted, like in prior studies, that having more lymph nodes removed does increase the risk of all of these complications. So a sentinel lymph node biopsy is a safe procedure to be done, and complication rates are pretty low, but if a surgeon does unintentionally remove more lymph nodes than 4, then some of these complications like lymphedema or a loss of feeling along the back of your arm may be persistent and may be things that you have to deal with for months or even years after your surgery. So it's important to have a conversation with your surgeon when you're deciding if you want a sentinel lymph node biopsy or not, and to talk to them about if they do have any situations where they've removed more lymph nodes than they intended to.